Hi, I'd like to welcome you all to our Community Mental Health webinar on teen mental health. My name's Jennifer Rinks and I'm the board chair of the Marin Healthcare District. And we are presenting this webinar as part of our webinar series, Community Mental Health or Community series on health issues for our community. So we look forward to our presentation this evening. And I would like to briefly introduce our presenters. We've got Jessica Colvin, who is the Tamalpais Union High School District Wellness Director. Also joining us is Kara M. Connors, and she's the Senior Program Coordinator for Suicide Prevention for the County of Marin Health and Human Services Department. We have Michelle Mazza, who's the Clinical Director of MindFit. And we have Heather Johnson, who's Clinical Director of Marin Huckleberry Youth Programs. So I hope you'll join me in welcoming our presenters. We're going to have a presentation and then there's going to be time for discussion and questions and answers. You can chat your questions or you can enter them in the Q&A panel. And with that, I will turn it over to our presenters. Thank you so much, everyone. And first up, we have Jessica. So Jessica, go ahead and take it away.
Hi, everyone. Great to see you all. My name is Jessica Colvin. I'm the TAM District Wellness Coordinator. I've been with the TAM District for 7 years. I was San Francisco Unified for 13 centers, and I've recently launched a new nonprofit called Swell, Schools Well, to help school districts across California. I'm here to, we can skip to the next slide. Oh, it says bad feedback audio. I hope it's okay. So I want to talk to you about what we know about the adolescent brain. So we know that the adolescent brain, we're just going to jump right in. We know that the adolescent brain is a time of significant growth and development inside the brain. The main change is that unused connections in the thinking and processing part of the teen brain, called the gray matter, are actually put away. Same time, other connections are strengthened. And I'm going to talk a little bit more about this in a minute. And this is the brain's way of becoming more efficient based on the use it or lose it principle. A few minutes, begins in the back of and moves to the front part of the brain. And the prefrontal cortex is remodeled last. And the prefrontal cortex is the decision-making part of the brain. Ability to plan, to think about consequences or actions, solve problems, control changes in this part continue into early adulthood. I'm going to go into this. Cortex is still developing. Teenagers might rely on a part of the brain called the amygdala to make decisions and solve problems more than adults do. And the amygdala, as we can imagine, is associated with emotions, impulses, aggression, and instinctive behavior. So teenagers have a really unique relationship with mental health. So the teenage brain is a work in progress in a good way. The brain is doing a lot of growing and learning during the teenage years and even into adulthood. And the structures in the brain are developing and adapting to all things going on in a teen's life. It's a great time to learn new skills because those things actually become cemented in the brain for the rest of your life. Behaviors like using drugs and alcohol and mental health can sometimes become at risk during this time. Oh, are you asking me to, Jennifer, do you want me to turn my camera off?
No, you don't need to. I was just suggesting maybe the other panelists do, but if you're still having challenges where you're getting messages about your audio quality, Jessica, then you could turn your camera off just to save some bandwidth. But let's try to see if we can move ahead like it is now, and hopefully we'll have better audio.
Okay, sorry about that. So we can stay on the slide. Our brains actually develop from the back to the front over our childhood and the teenage years. And the areas near the back of our brain, which control vision, then the areas in the middle of our brain called the limbic system control our emotions, as I mentioned. cortex. So a lot of the what's happening for teenagers is coming from that limbic system. Young people are about 25 years old, and they're actually saying up to 30 now. You can go to the next slide.
Okay, Jessica, I do think we should try you with your camera off and see if that improves the audio.
So sorry. So to put things simply, this is what's happening. So check it out. During your teen years, your brain has significant increases in synapse, the connections between neurons in the brain. Your brain kind of looks like an LA freeway. There are a lot of new connections and roads going everywhere. Next slide. If we can go to the next slide. Can you all hear me? Can you go to the next slide?
I think I just did. I can
One more.
advance again. Okay.
Still need one more. Okay, go back a few.
Yeah, I think that we're having, okay, my apologies. Okay. That
Back
one?
another one. No, one
Okay.
more. Okay. So there's a lot of, one more forward. So there's a lot of traffic. The teen brain is experiencing a lot of stimuli right now. And in essence, the chemicals in the brain feel like they're in kind of a bumper to bumper traffic on the highway. And as such, the brain functions well, but sometimes there's a lot of traffic slowing down your information processing, and this is totally normal. Okay, let's go to the next one. Then we've got the adult brain. So as you start to get older, your brain starts to prune away some of these additional connections to help consolidate our learning. And by the time a teen is in their mid-20s, the brain has reduced the number of synapses, or what we call freeways. Also during this time, the neurons are undergoing increased myelination, which involves forming a type of sheath or connecting channels or roads between neurons. This allows for the processing of information or travel between two places to be smoother and more efficient. So between the teenage and adult brain, there's a pruning process that makes things much more efficient. Next slide. And as you can see, as you get older, there's much less traffic and information flows a lot more smoothly. Okay. The adolescent brain is often likened to a car with a fully functional gas pedal, which is the reward system, and weak brakes, which is the prefrontal cortex. So I kind of like thinking about that as well. Okay, and you can go to the next slide. So as we can see, the adolescent brain is a work in progress going from the back to the forward part of the brain, with the prefrontal cortex coming in last, which really makes teenagers more emotional, less regulated, more impulsive, and mental health can really come through. A lot of mental health issues do come through during the teen years. Next slide. So adolescent brain and mental health. What we know is that 1 in 5 teens have a mental health condition, and those often show up by the age of 14. Next slide. And this is what we know in Marin County. So the last time that we did the California Healthy Kids Survey, and this is all of Marin County, these numbers are pretty shocking. Marin students reporting feeling chronically sad or hopeless for 2 weeks or more in the past 12 months, which is really different than feeling sad for a day or feeling sad for a day or two. For 2 weeks or more over the past 12 months was 21% of 7th graders, 29% of 9th graders, and 36% of 11th graders. That is almost 40% of our 11th graders have shown symptoms of depression. So as we can see, mental health is a real issue in Marin County. And the percentage of Marin students who have ever seriously considered attempting suicide is 9% in 7th grade, 14% in 9th, and 14% in 11th. So as we can see, it's developing, mental health is coming forward, and we have real issues to address during the teen years regarding mental health. And then some interesting facts about Marin mental health. Back in 2019, we did a community health needs assessment looking at suicide rates, different numbers for medication for mental health issues and substance abuse treatment. And it shows that there's a higher occurrence in Marin County than in California. So for example, the suicide rate in California is 9.8, and in Marin County, it's 15.6. The percentage of adults in California taking medication for mental health issues is 4% higher than the general population in California up in Marin. Also, the rates of binge drinking in Marin County is almost triple the number of the rates of binge drinking in California. And the levels of drug use is also significantly higher in Marin County than in California. This is all really interesting because Marin County is actually known as one of the healthiest counties in California, yet we have this kind of underbelly of what we're dealing with when it comes to mental health. Okay, next slide. So this is just a little bit more data. This slide shows that between 2018 and 2020, there were a total of 111 deaths by suicide in Marin. And in 2020, we saw a decrease in suicides, but this could be for several reasons. You can see that between March and May, during the initial lockdown of COVID with people being at home and together, there was not an increase during this time. But it also could be because people were afraid to go to the hospital if they were feeling suicidal. So we don't really know what the data is going to look like, but you can see kind of the differences between 2019, 2018, and 2020, and see that we have a real issue that we need to address, as we know that suicide can be preventable. Thank you so much. I'm sorry about my sound.
No worries. Next up, we have Kara Connors, who's going to be presenting. She's from the County of Marin Health and Human Services. Take it away, Kara.
Good evening. Thank you, Jennifer, and thank you, Jessica, for that great overview of the status of mental health among youth in Marin County. You can advance the slide. I'm going to build off a little bit about what Jessica had mentioned. There was a slide before here, Jennifer. I'm not sure if it's showing up. Okay, doesn't look like it is. But there was a slide before this that I wanted to share. And this slide, to start us off, was a quote by Kristen Neff, who is a self-compassion researcher with a PhD based in Berkeley. And one of my most favorite quotes of hers is, "Unlike self-criticism, which asks if you're good enough, self-compassion asks what's good for you." And I think as we're having this conversation around mental health, we can really ask ourselves, what are we doing to take care of ourselves so that we can model healthy coping for our youth? And so now is not the time to short ourselves, to model healthy coping and to fill your cup as we manage some really complicated issues, but not impossible ones. So I just wanted to share a little hope there. On that next slide about the facts about mental health, Jessica brought up some important statistics, and I just wanted to share that I think the real takeaway here is, if we look at the last two points on this slide, we know that almost half of those people in our community or in our country that are suffering from mental illness, that they often go without treatment. But what's interesting is that those that do, 80 to 90% of those who seek treatment for depression are treated nearly successfully. And the question is why? So why is it that 80 to 90% of those who do seek treatment can be successfully treated, but only half will seek treatment? And so there are many reasons for that, but one of those reasons can be attributed in large part to the role of stigma and the role that stigma plays in our life. So over the next few slides, I'll talk a little bit about the impact of stigma and what we can do to overcome it. So if we can move to the next slide. So what is stigma? Stigma is a mark of disgrace that sets a person apart from others. And when a person is labeled by their illness, they no longer see that individual, but as a part of a stereotyped group. So negative attitudes and beliefs towards this group can create prejudice, intentional or not, which leads to negative actions and discrimination. Next slide. So why does stigma exist? In part, it exists because of fear. Sometimes we have fear because of what we don't know or what we don't understand. So inaccurate or misleading misrepresentations of mental illness and mental health have contributed to our fear. We can look at examples all around in our media, our use of language. The film The Joker is one example of really scary misrepresentation of mental illness. And one of the things that's really interesting is that while the public accepts kind of the genetic or medical nature of mental health and the need for treatment, we still have a negative view of those who are experiencing mental illness. Let's go ahead to the next slide. There are three different types of stigma: public, self, and institutional. And we don't often look at it in that way. I'd like to talk about stereotypes and prejudice and discrimination, which is a consequence of both public, self, and institutional stigma. And I wanted to focus a little bit on self-stigma. Self-stigma says I am dangerous, incompetent, or I'm somebody to blame for my condition. And these are thoughts that can lead to lowered self-esteem and self-efficacy, a sense of hopelessness, of why try, and that somebody like me is not worthy of good health. And I think if each of us were to reflect on examples in our life and how our mental health is oftentimes treated differently than our physical health, we might approach our mental health in a different way. So for example, you have a broken leg, a concussion, an infection, we're much more likely to seek help for those more traditional types of medical conditions. But when it comes to our own mental health, we're much more likely to deny or have reluctance about seeking help. So as we talk about mental health this evening, try and think about ways in which in your own life, you might have prevented or thought twice about seeking help related to your mental health versus your own physical health. Next slide. So the impact of self-stigma, again, can contribute to worsening symptoms and reduce the likelihood of getting treatment. Families often receive lack of support and a fear of disclosure. And self-stigma can lead to negative effects on recovery, such as reduced hope, as I mentioned, low self-esteem, increased symptoms, difficulties with relationships, and reduced likelihood of staying with treatment, and possibly having more difficulties at work. So I think when we look at this, we can see that there's a lot of motivation for us to seek help and to support others who might be struggling. Next slide. So how do we stop stigma? What are some practical things that we can do? And I think part of that includes how we talk about mental health and what is the conversation and the language that we're using to talk about mental health. So here's an example of things of what to say and what not to say. Feel free to take a picture of this, and I'll just allude to a couple of examples in each of these columns. So if somebody that you know is struggling, you might say something like, "Thanks for opening up to me. Is there anything else I can do? How can I help? Thanks for sharing," validating somebody and letting them know that you appreciate them having the courage to speak up. Because as you know, we've talked a lot about stigma and what that means for a person to be reluctant to speak up. So thank them for sharing, thank them for their courage. And I'm sorry to hear that that must be really tough for you. These are really positive ways that we can support people. But there might be ways in which we've reflected on our own communication style where we might say things that where we inadvertently might make somebody reluctant to talk about their mental health. Saying things like, "Well, it could be worse, just deal with it, snap out of it. Everyone feels that way." And sometimes we might move through the conversation because we're not quite sure what to say. So feel free to use this handout as a way to kind of support your own conversation with your family and your friends. Next slide. So as you know, And we've all seen examples of different celebrities in our community who have used their mental health to raise awareness. And so there really is some truth to the power of storytelling. And research shows that knowing or having contact with someone with mental illness is one of the best ways to reduce stigma. When we know someone with mental illness, it becomes less scary and more relatable. Teens are talking about mental health. 3 in 4 young teens seeking information online about depression said they were looking for personal anecdotes from people who had suffered because they are more real and more relatable. And here's a quote here from The Rock. And he said, "I found that with depression, one of the most important things you could realize is that you're not alone, and you're not the first to go through it, and you're not the last to go through it." Towards the end of our presentation today, we'll talk about some activities that are taking place around May Mental Health Month, including a storytelling series. Next slide. I'd like to now introduce Michelle Mazza, who's the Clinical Director of MindFit for Dialectical Behavioral Therapy, as well as Heather Johnson, who's the Clinical Director for Marin Huckleberry Youth Programs. Thank you very much.
Hi, my name's Heather Johnson, and thank you, Cara. Thank you, Jessica, for laying the groundwork and continuing to be in this work with us. And as they mentioned, I am the clinical director at Huckleberry Youth Programs. And hopefully, as you guys know, Huckleberry Youth Programs has been in San Francisco and Marin County for over 50 years, working to empower youth by providing services that allow them to seek safety, to seek education around physical, sexual, and emotional well-being, as well as a way to join in social justice, as well as access to education. So today I'm going to kind of continue where Cara left off and work with Michelle on really talking about how do we have that conversation Cara's talking about. Because really the thing that we find most is that the stigma of not only that we put on ourselves, but that's in our communities prevents us from sharing our stories, prevents us from having the conversation with our friends, with other kids, with our own kids. And so we really want to help all of us together gain some capacity. So when we talk about how do we show up for our kids, how do we show up for our community, as Jessica and Cara both mentioned, and Michelle will elaborate more after I'm done, we really have to show up for ourselves first and foremost. So we really need to look at how are we feeling? Where are we? What is our history around mental health issues? What bias are we bringing to it? What kind of parenting style do we have? What do we do when we're in stressful situations? So that we might start to be able to practice tolerating difficult conversations and difficult emotions to prepare us to support other people when they're in difficult times. So as Cara said in that beautiful quote, we have to fill our own cup of tea, our cup, our bucket, our hearts, whatever metaphor you want to use. But we really do have to practice what we preach. And that means we have to slow down, we have to set aside time, and we have to seek our own support to practice these things before we try to offer it to other people. So I want to go from that invitation into talking about how do we normalize what happens in our youth as they start to grow older. And one thing Jessica talked about was the development of the brain. And with that occurring, right, and now we're starting to say that, you know, the brain is still developing until 25 or 30. We also have to look at the stage in which our teens are in. So like we might have a teen right now and they're in a teen stage, which is a massive transition, right? And they have all those synapses and they're super confused and overwhelmed. And then right now we have on top of that a pandemic, which we've never parented in before, they've never lived through before. And so I want to really normalize that we need to support each other through each transition. I think Michelle and I are going to go through a couple examples later, so I won't go more into that. But I just really want to invite everyone to remember that you don't have to be a professional, you don't have to be an expert to have these conversations. We all have lived experiences. We all know what it feels like to feel sad, angry, happy, confused, overwhelmed. And that's really what we're inviting, is that we need to model healthy management of those things. We need to model how to seek support for ourselves and for our youth. And we want to create an environment that is safe. What we really know is that no one will be able to seek support or be honest if they don't feel safe. So we need to create a space where the safety is there, not only physically, but emotionally, because that is where then people will start to listen, as well as to start to share. And so I did do a poll of a group of teens this week, and I asked them, what is the most important thing they wanted me to say to parents tonight? And the two last bullet points were the two things that they came up with unprompted by me, which was, I wish parents would listen to understand. Just listen, don't fix. Don't give me a solution. Don't try to change it. Just sit with me, just be with me. And to change expectations versus raise them. So a lot of times our youth come to us in a moment of crisis or a moment of just, need. And because we're uncomfortable with a topic, we want to fix it. And we go straight to that fix it mode, which actually puts more pressure on the youth to then think that they have to do more. Oh, great. Now I have to pretend I'm happy. Now I have to make more appointments. Now I have to go do more sports, or I have to get more exercise, or I have to go to therapy on top of it. So we want to really talk about how do we work and have this conversation to change maybe the timing, maybe the way in which we go at the expectations versus adding on to that plate that is already so full. You can change the slide, Jennifer. Thanks. So once again, I just really want to reiterate this idea that we all need support. We are all humans. As human beings, we, experience pain. I can't take away the pain, but I do believe that, like Cara said, there's hope. You don't have to suffer, and you don't have to suffer alone. So the example, I think Michelle and I can talk about a little bit, but we'll go into it later as well, is this child development stage. So if you remember first having your child, many of us were part of mothers groups. Some people might have had doulas. Some people might have had their parents move in, their in-laws move in. You might have had a lot of support around those first couple years of your child. And now here we are in what I think is actually a much more difficult stage. I have two teenagers, and I've never dealt with technology or the pandemic or any of the race and gender issues that are at the forefront right now. And it is not normal that I have a support group around that, or that my friends send me meals, or that someone says, hey, how do I give you a break so you can take a shower or cry your heart out? So I really want to normalize that we need support across all transitions for our teens and for ourselves. So what we invite you all to do is to reach out whenever you need a thought partner. It's not that you necessarily are going to do anything. It's not that the thought partner has to be a professional or an expert, but many of us just need to talk to someone to make sure that we're not in this alone, and that we actually are taking a deep breath and thinking through things before we, kind of go from 0 to 100. The second part of that is not one and done. Michelle gave a great example this week as we've been working together about how many times do each of us tell our kids, please, you need to say please. You didn't say thank you. So I don't know about you, I've got two teenagers, and I probably say that at least once, if not multiple times a day still. So if we think that we're going to have one conversation about sex, one conversation about drugs, one conversation about mental health, and it's done, that's not going to work. We need to have continual conversations at every transition. Did they change friends groups? Did they change schools? Did they change sports? Did they get a job? Are they driving? Right? They're major transitions that we have to kind of then sit down and look at our values as a family, and how do we open up the conversation and look at what is new and going on in that transition. I also think we all know a lot more than we believe we know. And so I always tell parents, like, trust your gut. You don't need to be an expert, like professionally. You know your kid, and better yet, your kid knows themselves. So if we listen, they will tell us. It's not going to be easy, and Michelle is going to go into that, but we just have to keep going back to the conversation. And then I also want to say one more thing before I turn it over to Michelle, which is minor consent. In this county and in this country, actually, your child at age 12 can seek support without you. And we highly recommend that kids do that if including their parents is a barrier. We as professionals are always going to work with a youth to include their parents. What is happening to them is not in a vacuum, right? So it affects anyone with a mental health issue. Not only does it affect them, it affects their family, it affects their community. So we are always going to work to try to include you, to try to get a release of information so that we can keep confidentiality, but we can do parenting tips. We can work as a team with other professionals or with you as a family. But if a child is not going to seek support because, like Cara talked about, stigma, or because they believe you wouldn't support it, we know that they are able to, through their schools, through your insurance providers, and through nonprofits like Huckleberry, to sign for their own consent for mental health services, for sex, health services, and physical health services. So we really want to make sure that you have that conversation with your kids and that they know that, because we wouldn't want them not to seek help only because they're afraid of burdening you and they're not ready to have that conversation yet. And if you'll change the slide, Jennifer, I'm going to turn it over to Michelle, and then I think she's going to give it back to me at the end for resources. And then at the end, we'll have a lot of time for questions. Thank you.
So I'm Michelle Mazza. I'm a clinical director and therapist of MindFit DBT Center, which is an outpatient program in Mill Valley. And we work with teenagers, young adults, and parents. And I'm also a parent of 2 teenagers. So I'm living it during the day and I'm breathing it and living it at night. I have a junior and an 8th grader. So I'm tasked today with addressing how do we know when to intervene with our teens. And we have a list here on this slide that lists a variety of issues that you probably have seen several times over this past year. I've seen this several times as a parent, especially during COVID. And in a nutshell, what we're looking at, like an overarching goal, is to look for a change in behavior. And I believe all the panelists have said this already. Adolescence is a time of change. And so the change can happen with mood, sleep, social groups, grooming, substances, appetite, eating, self-image. And the problem with this, though, is that in normal adolescence, all those things change anyways. So as parents, it becomes very challenging to figure out when this teen behavior has gone over the line to a level of concern. So you can go ahead and switch the slide, Jennifer. Thank you. So I like to think of the example of a fever. So as a parent, when I've evaluated one of my children having a fever, I become very curious and I ask questions. I talk to my child, try to understand the problem a little bit more. I try to maybe ask a friend their opinion, might consult with a doctor to see if I need to intervene. Ideally, we're doing that same thing about emotional issues. I think as parents, we tend to tiptoe a little more around that than we would maybe with a fever. So if we think about your skills and how you approach when your child has a fever, we want to do that and open the line of communication and bring curiosity about their emotions as well. So I use this graph. This is a skill in our DBT program for families. And these are our dilemmas as parents on a continuum. And in particular today, I'd like to look at the one that goes from the upper left corner to the lower right corner. And whether we're making light of problem behaviors or if we're making too much for adolescent behaviors. So I'd like, as we're considering all these changes that are happening in adolescence, that we consider a continuum, that we're going from kind of normative behaviors, things that we might typically see in adolescence, and then what is the extreme on the other end when we do have to intervene and there's really cause for concern. So this graphic shows that, and a couple examples of typical behavior when it can go over the line of concern is irritability. So it's very normal for kids to become more irritable in the teenage years. Their brains are changing, hormones are changing, they're tired, they're growing. And then when it goes to cause concern, you might see where the emotions just are more intense, they're more painful, they're more long lasting. There might be more mood dependent risky behaviors, and you see a really true inability to manage emotions, not because of inexperience, but just an inability to manage the intensity or the chronic level of mood issues. So that's when you would intervene a little bit more. Another just simple example is self-conscious. So there's an increase in self-awareness, more focus on self-image in adolescence, which is very normal. When it goes over into a level of perfectionism or withdraw socially, obsessiveness about hygiene, or a withdrawal from hygiene, a lack of hygiene, then it's gone into a level where we're concerned and we want to talk about it. So overall, though, I want to emphasize, and I think this is the theme of our whole webinar today from all of our panelists, is to frequently speak to our children about their emotional experience and be very direct with it. When we talk about emotions and validate them, they actually tend to regulate. When we ignore them, they tend to come out in other ways, in other dysfunctional behavior, or to really suppress and come out in problems in a different way. So you can go to the next slide, Jennifer. So this is a skill that I just created on the slide. It's not the whole skill that we use in our family groups, but there's a guiding principle in the DBT program that we provide that balances acceptance and change. So as a therapist and actually as a parent, I try to think of this and keep this principle in mind of when I approach my children, I want to balance where they are, and also maybe push for growth and kind of skill acquisition and change. In our community, I think we lean a lot more towards change. I think we're very used to telling our kids what they're doing, that we want them to change. We provide consequences immediately. We tell them how we want them to achieve. We might hire somebody to problem solve for us. And indirectly, if we're only balanced on this side, which is change, we're indirectly telling our children that, there's something wrong with them, that their emotions aren't acceptable. And if we simply balance that with more acceptance, and I can explain a little bit more what that is in a second. If we balance and approach our children with accepting their emotions, so you would do that by listening. For example, this morning, luckily it happened on the day of this presentation. I was talking to my son about him having his computer in his room at night. And I had gone to bed earlier than he did last night. And normally this conversation goes way south. We have an argument, it's all tense in the morning, we're all rushed. And this morning I decided, he came to me and was explaining why he had his computer. And normally I would interrupt him, said we have to get going, and cut him off. Today I just probably had a better night's sleep and approached him and said, tell me why. And he immediately regulated and spoke, and I simply listened. I didn't intervene, and I didn't correct anything, and I didn't ask him what I wanted to do later. I have to say that's very rare for me, but I noticed immediately that the actual listening shortened the conversation, which is what we needed at the time, and it regulated his emotion and reduced an argument. Another way that you can accept emotions is to validate them. You can do that simply by listening. You can do that by reflective listening, by saying back to what your child has said to you. We'll give examples later of how to validate and how to do this acceptance side of this continuum. And then also today, I really, really want to emphasize the importance of tolerance as a parent. I work with parents all the time. I work with teenagers all the time. And there's times when I go into my kids' room with my aim, thinking of all my education and all my experience, and I say something and I get a really bad reaction back. I get a dismissal, I get an "oh mom," an eye roll, or anger. And if I'm able to tolerate that and know that if I just give the time in the moment and come back to that conversation later, I'm emphasizing that I care about their emotional experience, which long-term teaches emotional skills. So I can't emphasize that enough. I want to say it again, but tolerating emotions, tolerating a negative response, and then going back later to revisit is really helpful in teaching kids emotional skills. So I don't know if any of you have had the experience recently of having your child not want to return to in-person learning on campus, but an example of doing this balance of acceptance and change would be saying, I know this is yet another change this year. I know you might feel stressed and this feels weird to go back to school. That would be the acceptance side. And we've done these transitions to school well before, and I know you can do it. That would be the change side. Okay, go ahead and put the next slide, Jennifer. Heather and I created a lot of sentences here that we hope are very tangible ways to practice communicating with your kids and balancing that validation and acknowledgement of emotions and challenges. I hope there's questions later specifically about what you can say to your kids, but I list several things here. I don't know if I'm going to be able to hit all of them. I just addressed the tolerating negative emotions, which is the first one. Validating your emotional experience, which will help regulate the emotion. And then to really consider the timing of when you're speaking to your kids. So on the way to school, right when something is due for class, when there's a big project that your child is working on, at the end of the day when everybody's tired, probably not the best time. Okay, and especially during COVID, there's so much more stress and check-ins. We're witnessing everything with our kids being in our homes more. And so, you know, going in and asking a question and asking if they have time or if they can speak in 20 minutes just kind of captures their developmental stage. And I think just opens a better conversation with them. They're more willing at that point. Also, using I statements. I tend to think this can be very cliche. I don't know if everybody else has heard of this. I talk about this all the time. But using I statements where a parent might say, I would like you to do this. I am concerned, is very different than a parent saying, you need to do this. I'm dubbed in my family, I've given me this name, motivation killer. So, you know, my kids share all the time. If I bring up something to them, I've asked them to do it. They really just don't want to do it because I've said it in that particular way. So I encourage you to use I statements and say, I feel, I'm concerned, I would like, so that it's a joining conversation. Also, if you schedule positive activities with your children, and there's positive emotions attached with those activities, those positive emotions build upon each other. There's research behind that, and it insulates you from when there is tension. Okay, and then another thing I want to address is ask questions. Again, I think I addressed this a little bit a couple topics earlier, where if you ask questions developmentally, you're encouraging your client to participate in the problem solving. It invites them, and it's also for them to learn skills as they get older and leave for college. And the last few things here is really modeling self-disclosure of your emotional experience. I notice sometimes if I'm in the car, if I'm picking up my kids from school, if they actually ask me about my day, I try to share something that is authentic. and that I've had some struggle with, and that I value their input. I might ask for feedback, and I might also show a successful management of it, so that they can see that problem solving and addressing issues makes things better. And then also modeling time to calm down. This is crucial. I find this hard as a parent when the emotions are high, and emotions are high in COVID as well, right? Doing new things, we're all going back to school, we're trying to integrate back into our activities. So modeling time when emotions are high. And when emotions are high, we tend to think of it in extremes and we can't see things clearly. So I suggest as a parent really modeling, I'm not going to say anything that's good here. I'm going to take 15 minutes and go calm down. It's really important that you say that you're going to come back though. Okay. I am teaching families more now than when I first started my career. Now that I'm a parent, especially now that I have teenagers at home, the importance of tension and repair. I don't believe that any family, no matter what skill level, will a parent always say things perfectly and avoid tension. I think we all know that. So the idea is that we're all going to screw up, and that as parents, we can take time to calm down, come back, and repair better. If we don't go back and repair, I think there's a lot left for interpretation from our children, wondering why. I think their interpretation can sometimes be that people don't care, or that the emotions aren't valued, that we don't value their emotional experience, which leads again to more emotional challenges. So that's pretty much what I have. The next slide, I'm going to invite Heather to join me again. A lot of the points covered what everybody has said already in this presentation, and I don't want to prevent time from questions and answers. But here are some other examples of how you can lead into conversation. Again, leading with empathy, leading with validation usually opens the conversation better. And just some examples here on the right side. How can I help you with this? Help me understand. How would you like things to be different? What are the good things about blank, and what are the less good things about it? When would you be most likely to do this? So those are just some more examples adding to what Cara provided us earlier. And I'm going to hand it back to Heather so she can follow through with some resources, and I would be happy to answer any questions at the end. Thank you.
Yeah, thanks, Michelle. I think if we stay on this slide for 1 second, one other example, just to be vulnerable and be like Michelle and talk about our own experience with our own teens is, we're eating, breathing, living this in our day-to-day, and it's definitely a lot easier to do it with someone else's kids than your own. So don't think that we've got it solved or we're good at this at home, because we make mistakes too. And I'll just be totally transparent and tell you the one I dealt with last week is, going back to full bore last week was a lot, right? It was a lot of driving. It was a lot of redoing the whole schedule. Meanwhile, most of us been working, tremendous amount of hours, and, it took a lot of scheduling and adjusting. And I wasn't aware of how little space I had somewhere through the middle of the week, and how much of in a hurry I was. But on one of the days that my kid was actually Zooming and not on campus, I just had it stuck in my head that I kind of was neglecting my kid by not checking in because I was so busy. And so when I did have a break, I went down, and just like Michelle said not to do, I used you. And I said, you need to get outside. It's a beautiful day. You need to go do your sport. You need to take the dog for a walk. And I think I listed about 5 things that she, was supposed to be doing. And I definitely in my tone made it clear that I can't believe you wouldn't do this on your own. And you can imagine the response was very negative. She was defensive. I didn't ask if she had time. I didn't ask her what she was doing. I didn't ask her even if she had done it, which I just kind of came in, just with all my, expectations. Anyway, as you know, it went horribly. None of the things happened. We ended up in an argument. It did not go well. But as Michelle said, the next day I did apologize and I did own where I was at and what my intention was. Didn't mean that I was right. It just meant that, I'll try better next time. And oddly enough, I then found myself in the same position again at the end of the week. And instead of doing what I did before, I went to her and said, I'm dysregulated. I need movement. I need to get outside. I said, I'm going outside. I hope you'll join me. And within moments, she was outside with me and we had the best 10 minutes, and that's all I wanted the day before. And it was entirely that I talked about what I needed. And it wasn't about making her wrong for not doing that on her own. So I just give you that example to normalize that we too are not experts or perfect at doing this. Jennifer, will you change the slide, please? So I'm now going to go into really talking about resources, and we're going to try to give you kind of a broad view of this, and then obviously Jennifer is going to be posting on the website the actual numbers, email addresses, websites, all the resources for you to have, as well as this presentation. So I don't want you to feel like you have to write things down and figure this all out and figure out the continuum of care. Really, the only thing we want you to take away is we want you to ask and listen to your teen as well as yourselves. And we want you to refer them or a friend or your child referring a friend when you don't feel capable of having that conversation or when you think you or they need more support. So that's really all I want you to think about is how do you show up? Well, it's not letting them be alone. It's asking and listening. And then from there, together, you can get to that next person. And that next person will help you then go from there. So you don't have to be an expert. There are people who will intervene and help you along the way. And so there are many resources that we'll go on to show you, but there are hotlines, meaning that they're on 24/7 if you're in a crisis. We have warm lines, which is usually run by a peer or, has different hours, but might just be a place to talk. You're not in crisis, but you don't have a friend or a family member you can talk to and you need to talk in that moment. Like we said, we do have crisis interventions and crisis teams, some of which you have to go to, some of which will come to you. We invite you always, if you're concerned, to first start with your pediatrician or your own doctor. Go and get your blood work done. Go and get, any labs done. Go talk about what's happening to you physically and emotionally. And then, they can help connect you depending on insurance or not insurance, with resources. Also, Jessica, obviously, and at every school district, whether you're in TAM Unified, San Rafael, Novato, if you're out in West Marin and Shoreline, wherever you are, Sausalito, any of these different districts, there are social workers or wellness staff that are there to help you and your children navigate seeking help. So once again, we want kids to self-advocate. Like we said, at 12 and above, they can sign for their own consent for services, as well as we want you to know that the school is a resource. And so one of the resources you'll see, for example, for TAM Unified is their virtual website that has lots of links to us, as well as, each of your school districts have all of this information and have it available to you. I particularly come from a nonprofit standpoint. Obviously, we work hand in hand. We have therapists in the schools. We work hand in hand with the schools, with doctors, with probation, with the county. So there is a lot of different ways to seek help. It doesn't necessarily have to be privately funded or through your insurance. And it doesn't necessarily have to be talk therapy either. And it doesn't necessarily have to be a therapist. There are lots of different ways of seeking therapy, whether it be art therapy, somatic therapy, talk therapy, equestrian therapy, equine therapy. There's all sorts of different things. Lots of groups. One of the good things that came out of COVID is a lot of connection virtually, where a lot of people are getting support they wouldn't have gotten if they had to physically show up. So we're not going to get rid of that. Lots of different levels of treatment, whether that be outpatient, intensive outpatient, inpatient, or just maybe, just once a week individual or family or couples therapy. We always will invite you to first go through your insurance and make sure you use a provider so you don't have to pay out of pocket. But certainly there are services like ours that we just take Medi-Cal, or people who have no insurance, or what we consider underinsured, which is generally people who might have a different level of insurance and they're not getting enough mental health support through that. And then at the end, Cara will talk about May being Mental Health Awareness Month. And we invite you to join the Marin County's Suicide Prevention Collaborative, as well as join all of those different events. And Jennifer, if you'll go to the next slide. So like we said, I don't want you to have to write these down. This is accessible to you, this as well as the entire sheet of all these numbers. But I did want to make you aware that Marin Mobile Crisis, if you didn't know, has extended their hours, as well as they now do have transportation. So if you happen to have a youth that needs to be assessed, you need someone to come to your home, they're able to do that, right? They will come to you, or they will do it over the phone. And if they can transfer someone to the crisis stabilization, they will. If they can't and you're available, ideally you will. And if not, then we do rely on the police at times to come in and do that as well. If mobile crisis isn't available, or you can't remember that number, or you can't find the resource list, call 911 or go to your nearest hospital. Obviously at Marin Health, we have the crisis stabilization unit, we have the ER, we have an amazing staff at the county and at the hospital to help you. And then obviously there are Safe and Sound, and you can call them 24/7 to ask questions to know, when do I need more help? When do I need to take my kid in? So once again, you don't have to be an expert. If you don't know if you're at that level, call someone and ask for an assessment, or ask them to help you to determine, do you just need to help regulate your kid, or do you need to take them somewhere to make sure that they're safe? Can you go to the next slide, please? So once again, lots of numbers. Don't get overwhelmed, please. Don't try to write them all down. But we just want to show you that there is lots of us out there and lots of ways to seek support. So there are text lines for support. There's the 24-hour hotlines. There's apps like the My3 app. You can do a safety plan with your kid, and they have it on their phone, and they have a calling tree of who they call and what order if they're feeling dysregulated. And as we said, then there's the staff on the school sites. There's obviously all of us at different, at our offices or at the county level or at the hospital level to be available. One resource I did want to make sure that you all know about is Huckleberry House. So as I said, Huckleberry has been in the community since the Summer of Love. We started the first teen runaway shelter in 1967. We unfortunately don't want to have one in Marin anymore. We used to have one in Marin and the city. Currently, there's only one in the city. But if your youth needs a break or needs a place to go, and you know that maybe they're a flight risk, they're going to run away, or that if they did something, they're going to need a cooling off period, we really hope that you'll give them the number for Huckleberry House and consider them going there if that is needed. That staff, like I said, they will take them in. They will be able to be housed for a certain period of time while we work with you, the family, and or the county to get them the support that they need for that next level of care or for coming home. Next slide, Jennifer. These are resources, like I said, it's the virtual site for TAM Unified. Also, Marin County Office of Education has a lot of these videos we've done that are recorded. They also have an entire list in Spanish and in English of all those resource numbers I said. We also have a whole social emotional video series. The NAMI link will give you an entire not pamphlet, but an entire book really, or workbook on how to navigate a mental health crisis and who and like what's the continuum of care and how it looks and how you go from one step to another. So that's really a good thing to educate yourself in as a parent, so that when you are in crisis, you stay calm, right? There's nothing worse than being in a stressful situation, someone relying on you for information and you feeling like you don't know. So that's where we invite you to educate yourself, to regulate yourself, or to call someone as a thought partner to help you through that moment. And then obviously at the bottom, there's the Let's Talk series that's put out by Marin Health Youth Partnership. And we just finished the whole series for this year. But that is the pamphlet that goes out to every 9th grader, to your families, about talking about mental health and substance use. It's available in English and Spanish as well. All of the video lectures we've done with it are also recorded on their website. And starting this year, that actually is going to change. And not only will it be sent to 9th graders, but also 6th grade families. So we really invite you to use that as a resource as well. Jennifer, can you change the slide? I think it goes to Cara at this moment.
It does go to Cara, but Michelle wanted to share one more resource. So let's turn it over to Michelle, and then we'll go over to Cara. And then I know we're a little bit over time, but we haven't gotten any questions yet. So if people do have questions or comments that they'd like to share, we'll go a little bit longer and go ahead and chat those, or let me know to unmute you and I will do that. So take it away, Michelle, and then we'll go to Cara.
Okay, really briefly, I provided, it's in our document, so the host, Jennifer, will share with all the participants a list of the normative developmental behaviors that we see in teenagers and when it crosses over to concern, and some clear examples of when the behaviors have gone to that level. And then also there's some wonderful podcasts out there right now. I think one of the silver linings of COVID is that a lot of people went online and had to use that format to educate people. And one that I want to share for some really tangible dialogue about how to speak to children and when to be concerned again and when to intervene is Fluster Cluck. I'll make sure that's sent in the chat or the resources because I find it right away, but it's through Lynn Lyons, who is an expert in anxiety. And she does a wonderful dialogue with her host on a variety of topics of shame, self-harm, going back to school, how to talk to your kids, depression, the list goes on. She has a wonderful list of podcasts. So I'll make sure that our host, Jennifer, gets that as well to share with the participants.
Thanks so much, Michelle, and let's hand it off to Cara.
I think there's another slide after this, Jennifer. There we go. So in closing, thank you very much for joining us today. I think as all of the panelists have focused on the importance of having the conversation, talking openly about our mental health with your teens, your family, and your friends. And I think it's really critical that we look at one another as resources and we share our stories and experiences because that's how we learn. All of this is critical as we build a safe and inclusive community for mental health. Remember, as we're having these conversations, that oftentimes listening alone can be a great door opener. So as we move through adolescence, as we move through COVID, it's really important to stay connected to one another. And one way that we can help foster support, awareness, education, reduce stigma, increase help seeking is by participating in May is Mental Health Awareness Month. We've got lots going on in the month of May, and this is a flyer that hopefully you'll see going out around our community. We have many, many events. But as I mentioned, there is one particular event that's going to be hosted by the National Alliance for Mental Illness in our community, and they are hosting a storytelling series. And I think it would be really great for all of us to be able to divide and conquer with our family, attend some of these events on your own, or have them go to some events and you go to others and have a dialogue about what you're learning. If you have any questions about your interest in joining these events or the Marin County Suicide Prevention Collaborative, it's a public event. We meet every first Wednesday of the month, and our next meeting is May 5th at 2 o'clock. And that is also on this list of events. So thank you very much. And we're available for questions.
Thanks so much, Cara, and to all the panelists. You did a wonderful job presenting, and I think it was a really engaging discussion. We did have one question that came in so far, and that was, what are the community centers or activities for teens in our community? Places where they can gather and have fun. So if anybody, any of our panelists have any suggestions or responses to that, please go ahead and share.
I mean, I can give, the quick answer, which is not a good answer, is it's a little bit in flux at the moment because we're just coming out of COVID, right? So what was is not standard right now and is in the midst of changing. So I do know that as we have, higher rates of vaccination, as people are getting more comfortable, hopefully as we go into the yellow, that a lot of the community centers and nonprofits and schools are really looking at, in particular, what's going to happen this summer, right? Or what's happening, as we kind of go back to school. So I can't say that there's one place to go to for all of that information. I wish I could. But what I would tell you is call or talk to your community centers and see what they are planning. And certainly they do provide spaces, and do activities at school, at the community centers, and in the county in general. But like I said, unfortunately, I can't tell you that there's one place to go to get all of it. Jessica probably has, a better idea of specifically what's happening, in Southern Marin, maybe. But like I said, I know it's all really kind of in flux at the moment. So that's unfortunately my answer.
Yeah, this is Jessica. I don't have a ton more to add because everything is kind of closed right now, but there are some really cool programs at each of our schools called Friday Night Live, where the kids come up with really fun activities like dodgeball and movie night. And those are activities that you can get connected to through the high schools. And then I also know that the community centers have a lot of programs as well.
One of the questions that had come in earlier was what to do if your child is reluctant to go back to high school, given the whole COVID situation and the anxiety that they might have about that. Have you all been sort of hearing that question, and what is your response to that?
I've been hearing it a lot, and I've been quite surprised how challenging this response has been for parents. I'm really concerned that kids probably don't want to go back to the level of activities and busyness that they had prior to COVID, and they kind of had a taste of like a different type of a schedule. However, the lack of contact with peers, the lack of contact with teachers, the practice that they need so much about interacting with people in the community, navigating problems, I think it's really important that they get back integrated as much as possible. So I've been encouraging, I used it as an example in the presentation to, validate that it feels awkward, it's hard, that, most of the time anxiety doesn't just start COVID, it might have been there before, but to validate the anxiety and that as a family that you can handle it and that you believe in them and that you will support them in any way getting back into kind of a more typical schedule. Yeah.
Excellent. I know we're running out of time here. We're actually a little bit over time. So I thank everybody for sort of hanging in there. One other question I wanted to pose is, as an adult, as a teen dealing with all of this, what is a teen to do if their adult, their family member, their parent is experiencing depression or even maybe is suicidal? So I know we've talked a lot about teens, but sometimes teens' anxiety is really related to more adult anxiety. So what do we do in that situation where it's the adult that's maybe going through the mental health crisis, but that's actually impacting the teen's mental health?
I don't know, Michelle, do you want to start?
Yeah, I mean, I think that really depends. I mean, I think it depends on the severity. I think it depends on the skill level of the adolescent. I really hope that adolescent has another adult, like Heather said, a thought partner in their world that they can go to and brainstorm. I mean, I encourage, kids to also be direct, like we talked about throughout the presentation of, I'm concerned, I'm worried. But really, when it crosses over where it's really impacting the kid, I would hope that the teen could go to a trusted adult, like a teacher or a school counselor. Yeah.
That's exactly what I would say, is getting connected to a trusted adult who knows how to navigate systems. A school social worker, a therapist can figure out how to approach the parent, how to reach out to the parent. Schools have different confidentiality laws than therapists and can actually reach out at times that therapists can't. So just connecting to that trusted adult to help them navigate. No young person should have to navigate that alone.
Okay.
Also,
Well, thank you.
I can.
Yeah,
okay.
go ahead. Go ahead, Michelle.
I'm just going to add, I heard something today that I found interesting, because I know we also wanted to address COVID, that, I heard something that the companies now that are advertising based on kind of integrating back into the community. I heard, some of these tracking apps that we're using for our teenagers. One of them was advertising, you've known where your kid has been for this amount of time, and won't it be nice to continue doing that? So just to be aware that, we could be capitalizing on fear as a society about the transition, and to be really aware as a parent of, hearing about learning loss, about how severe everything is. In reality, there's a lot of kids that are managing quite well. That the communication is the piece that we need to keep going, but just to have parents be aware that this transition back could be maybe a little anxiety provoking.
All right. Well, I want to thank all of our panelists today. I thought this was a fabulous presentation. You shared so many excellent resources. I really want to thank you for that. We will be posting the slide deck and these resources on our website at marinhealthcare.org. So I encourage you to access them there. We will also be posting a link to this webinar, so you can share it with your friends and your colleagues and even your teen. I think there, again, a lot of good information that was presented. So please do take care of your own mental health and the mental health of those you love, and do what you need to do to support yourself and the people around you during these still very trying times. So again, please join me in thanking our panelists for a really terrific presentation this evening, and have a wonderful rest of your evening and rest of the week. Thank you.
Thank you, Jennifer.
Thanks,
You did
Jessica.
it.
Thanks, Michelle. Thanks, Cara.
You did. Michelle and Heather, you did a really fantastic job.
Same across the board. I don't know if anybody else can.
And Heather, thank you for leading us.
You're welcome.
Yeah,
Really
all the
appreciate
text. Yeah, it was great.
All right.
Good night,
Well, thanks,
everybody.
ladies. I look forward to
Thank
continuing
you. It
to
was
work
great.
with you.
Great
I
working
sent
with
you an
guys.
email, Heather.